I'm going to be doing an epidural today, so I'm going to review the patient's chart before I get into the room. I'm going to be looking for height, weight, platelet trend greater than 100,000, and any abnormal health history. So I'm going to come into the room, I'm going to introduce myself. Hi, my name is Adam, I'm going to be your CRNA today. We're going to be doing an epidural for your C-section, and this is going to reduce the amount of pain meds we have to give you while reducing your pain. Some alternatives could be putting you to sleep, but we don't want to do that due to complications that could happen with your baby. Some side effects or risks of this procedure include bleeding, infection, hypotension, and rarely nerve injury. If that's something you'd like to do, then we'll get a consent form signed. So the consent signed, we're going to explain the procedure. So this procedure, I'm going to have you positioned at the edge of the bed towards me in a C position like a mad cat. I'm going to palpate your hips and feel for Chauffeur's line, L4, and midline. Any deviation of the spine like scoliosis. I don't see anything, so I'll just mark a little spot here where I want to go. Gather my supplies. This is going to be a sterile procedure, so I'm wearing a mask, and the patient's going to be wearing a mask as well as everyone in the room. So here's your mask. Gather my supplies. I have my sterile gloves and my epidural kit. I'm going to open up my kit. Put on my sterile gloves. Gonna prep the back, sterilize it. We got povidone iodine solution. We're gonna do 3 swabs. You're gonna feel cold on your back. We're gonna go from the center outwards 3 times, and we're gonna make sure we go high and low enough in case we have to go up or down a level. Let that dry, and then grab my drape. It's in position. I have ampules in my kit, so I'm going to be using a filter needle to drop all my medications. Filter needle, first I'm going to drop my 1% lidocaine. This is going to numb the skin. So I'm going to do 1.5 cc's. Put a 27 gauge needle on that so it's ready. Next I'm going to drop my test dose, which is 1.5% lidocaine with 1 to 200,000 mics of epi. I'm going to draw 3 cc's of that. And then for my loss of resistance technique syringe, I'm going to drop 2 cc's of normal saline, preservative free. So I'm going to start by numbing the skin. You're going to feel a poke. Injecting as I advance through the subcu tissue. Get my Tui needle. You're going to feel some pressure here. I'm going to insert until I meet resistance. Pull up my stylet. Grab my loss of resistance syringe. Have my bromage grip. Going to advance As I'm applying pressure to this syringe, lost resistance there. I'm at about 5 centimeters deep. Grab my catheter. I want to insert about 5 centimeters beyond what I'm at in the skin, so that would be about 10 centimeters. I'll go a little extra just in case and adjust later. Explain to the patient that they might get a zinger down their leg, but that should resolve. Once I'm at my appropriate depth, I'm going to withdraw my tuning needle while advancing the catheter slightly. Once I see my catheter, grab a hold of that. Make sure I don't drop the catheter because this is still sterile. I'm going to secure this once I put it at the appropriate depth at 10 centimeters. Put a little loop at the bottom. Grab my securing device. Attach that to the skin. Just while I'm here, I'm going to put on an epidural sticker so everyone knows. Grab my catheter adapter so I can give a test dose. So I'm going to explain to the patient with the test dose some signs we don't want to have would be metallic taste, numbing around the mouth, ringing in the ears, heart rate increased by about 20%, same with systolic blood pressure or pain relief in the legs. I audibly hear my heart rate going off so I can listen for any changes. Aspirate a little bit, see if I get any blood. I don't, so then I'm going to give my test dose. Wait about 3 minutes. And if the patient doesn't complain of any pain or any of the positive signs and symptoms of a positive test dose, then I'll proceed with my therapeutic dose. So this is going to be 2% lidocaine, 15 cc's. We're going to give this in small incremental doses to avoid any side effects. Vital signs are going off every 5 minutes. I'm charting that, doing that for at least 15 minutes, and then chart the procedure at the end. While I'm slowly giving this dose, I can finish up with my dressing, put a Tegaderm on the site and tape up the back and loop this catheter over the shoulder. Over time, I'll finish giving this entire dose and then get the patient comfortable. For a spinal now, everything's the same up until when we localize the skin. So for spinal, I'm going to grab my introducer needle. Insert that. Grab a spinal needle. Bevel up. Insert that. And advance until I feel a pop. I felt a pop there. Remove the stylet, see if I get any CSF. Just to replicate the CSF, I'm going to push on the plunger, see if I get anything. And I do. Drop of CSF coming out. So then I'll grab my syringe of 0.75% bupivacaine. It's going to be 2 cc's of that. Have the bromage grip. Attach my syringe, withdraw. See that I see CSF coming out. And then inject my dose. And once that's done, pull everything out. I'm going to position the patient upright because they're going to have a saddle block and that's going to soak. And then once that's done soaking, I can lay them down flat, treat any hypotension with fluids or ephedrine and phenylephrine, documenting vital signs every 5 minutes for at least 15 minutes, and then charting the procedure.